Before we get into today's episode, I've created a short questionnaire that will help me get to know you better. Those that fill out the questionnaire will get entered into a draw to win an Amazon gift card. So there's a link in the description for the episode. Click it, fill out the questionnaire, and I look forward to hearing your feedback. Now for today's episode. This is the Michael Brighton Show. Hi everyone, welcome back to the show. And today I'm joined with Ari Parker, who is America's leading Medicare expert. He's authored the best-selling book, It's Not That Complicated, essentially educating older Americans on how to build their wealth and their health in the best possible way. So Ari, thanks for joining me.
Thanks for having me on the show.
So what is the first thing that springs to mind when we think health and wealth in the future? It seems like for it to be in the best possible way when we retire or when we hit that older generation, it involves a lot of planning and forethought when you're younger.
Absolutely, because healthcare is a large portion of someone's budget, especially in the United States. In fact, for the average retiree in the US, it's 41% of their income. So 41% of their Social Security check typically goes towards healthcare expenses. As you mentioned, it's a planning exercise. In order to retire, you need to have enough money set aside in order to pay for your healthcare needs.
It sounds like it's not something you would think about until it becomes important. I can't tell you how many people that have tried to get healthier, tried to get fitter, but until something happens to them, whether it be a health scare, whether they get this negative test on something that they thought would go well and didn't, it's normally a bit of an experience or a test that doesn't go their way that makes them think, oh, maybe I should look after myself better.
Absolutely. And in the US, I would really there's a patchwork of different systems, of different insurance plans for people to choose. The one for older aged Americans is called Medicare. Medicare is the government program for people who are 65 and up, or someone who has end stage renal disease and or Medicare by way of disability and is younger than 65. And it applies to 65 million Americans. There's 65 million people in the US that have Medicare. And Medicare is a safety net because it covers 80% of their medical costs. Still, as you mentioned, the 20% can break the bank, and that's an important planning exercise before one retires.
Is it easier to plan the earlier you do it? Like investors will say, like you get in early and you can essentially just sit on it because you've got in early enough that you'll benefit long term anyway. Is the Medicare system similar, whereby if you start saving for it and planning for it when you're younger, it will just get easier the more you do it just because you've been in the game longer?
To some extent, there's forced savings in this country because there's actually two parts to original Medicare. So, original Medicare was established in the mid 1960s as part of the Great Society program by Lyndon B. Johnson. It was a remarkable achievement. There had been tens of millions of older aged Americans that were living in poverty and couldn't get any health care at all. They were dying on the sidewalk. And so, what Medicare established was a safety net program for older aged Americans to get health care. And there's a forced saving aspect to it because a part of Medicare is deducted from one's payroll tax during their working years. There's another aspect to it, though, where you have to pay out of pocket for your, or pardon, not out of pocket, but you have to pay a premium to the government for the cost of your insurance. So there's two parts. I think of it as a three-legged stool, though. The three legs are hospital. That means you're inpatient. You have a wristband. Outpatient, visits to the doctor. And then the final leg of the stool is drug coverage.
Right. So it's almost like you would have those three elements that would work together in tandem and those sorts of things. I think that you've probably mentioned in the past that you're actually struggling to cope with the demand, almost like Medicare's not fully covering people that really need it. Am I right in saying that? Like the system doesn't really handle the demand all that well.
But by and large, the Medicare system does an excellent job at delivering healthcare to older aged Americans. It is one of the most popular government programs, perhaps the most popular program in the United States. And many people don't even attribute it to the government, which is a good sign that it's doing its job.
So is that one of the things though where it's in the background, it's part of the method of it almost? Like if you don't attribute it to the government, that means that well, we're doing our job then because the idea is for it to be simple and straightforward enough that it doesn't impact your quality of life when you're younger. Like it works better when it's more convenient to prepare for.
I think you're hitting on an important point, which is that even though the system is designed to deliver a good healthcare, well, it's a relatively good healthcare outcome for older aged Americans. That is, they can get the care that they need when they're sick. There's an aspect, though, which is that it's a very expensive system to support and maintain. And so younger Americans are rightfully worried as to whether the system will deliver the same benefits that it has for their parents and grandparents. And
So
that's an
is it,
open
yeah.
question that our society will need to address because the system is expensive. It is underfunded. It's only funded through the late 2020s. And there needs to be planning involved in order to guarantee benefits for millennials, for example, because we will, as a generation, age into Medicare one day.
Yes, it seems like the younger generation might look at it and think, do I invest in it when I'm younger, when they can't quite see the benefit or see it working, given the cost of it? It's almost like, could I put that money elsewhere and be better off?
I think the investment question is tricky because for someone who's in their 20s or 30s and they're working, a portion of your federal payroll tax is going towards Medicare. It's going towards the Medicare Trust Fund. The Medicare Trust Fund funds Medicare Part A, which is hospital coverage. It's the first leg of the stool, means you're inpatient. It also funds a tiny portion of Part B, which is outpatient. But people don't realize that there are these unfunded obligations for the remainder of one's outpatient obligations. That is visits to the
Right.
doctor, durable medical equipment, which is becoming more and more common.
I imagine that makes it difficult for people that have certain conditions. Maybe they're given prescription medication and the Medicare doesn't cover it because, as you said, it's one of the last legs of the stool that I'm guessing you were about to say that it doesn't cover prescriptions. Am I right in saying that?
You took the words out of my mouth. That's exactly what I was about to say, is that um, the prescription the prescription benefit was added to Medicare 40 years later. There was no drug coverage in the mid 1960s as part of original Medicare. It was only added 40 years later by bipartisan agreement. And the drug aspect that is people's most common interaction with the healthcare system, going to the pharmacist and filling their prescriptions. It wasn't like that in the mid 1960s. So that's a totally new obligation the government has to fund. That is handled through private insurance companies mainly. People purchase a standalone prescription drug plan. So even though Part D as in drugs, is part of Medicare, in order to access that benefit, you need to purchase a private plan in the United States.
I guess would be outside of the rest that you're paying into, meaning it'd be a separate plan that you would have to pay into after the Medicare payments come out of your income. You would then have to set aside another amount for this privatized system that you've needed to cover your prescriptions. It makes me think, is that in part why they push drugs so heavily? Because then they don't have to pay for your medical. Like if it gets so bad that you end up being admitted to hospital, it's covered conveniently. But if they can prevent it or assist in it through drug use or prescription medication, that sort of thing, then it's actually less of a burden on what you're paying for through Medicare. So if you're with the older population and you can prevent going into hospital through prescriptions, it's actually in their favor to do that.
Michael, it's a great point. That's right. If the largest cost to the Medicare program is hospital readmittance. So it's not the first admittance to the hospital, it's the second and third admittances that get really costly for Medicare to cover. So something in order to control costs that Medicare has been looking at closely is when does someone go back to the hospital for the same condition that they were already there for?
That must make it very difficult then for people that need regular treatment, not necessarily curable or preventable with medication. And some people have, whether it's checkups or regular operations, if it's something that they've got to maintain through operations and things like that. Some conditions are simply not maintainable or manageable with the, I guess you would say, easier or more convenient methods. So some people need the more intense methods that you can only get from a hospital.
That's right. There has been an emphasis, as you mentioned, on prevention and for going for regular wellness checks, which are entirely covered by Medicare Part B, the outpatient component. But that's right. For an uncontrolled condition, sometimes people need inpatient hospital treatment. And that's where the costs really start to add up for the Medicare program. And one thing that there has been an expansion, especially since the pandemic started, in helping people access telehealth, which is a way, especially if they're in a rural part of the United States, that they can get affordable medical consultation with their doctor without going to the hospital if their condition spirals.
So is this a big part of why there's so much like medical debt? People are struggling financially because it's a bit more of a pay into system than, let's say, what we have over in the UK when we have the NHS, which apparently is covered in taxes, even though we're probably aware, or hopefully aware at this point, that the taxes don't really cover it as much as people think it does. Like you hear a lot of arguments over in the UK about, oh, well, we pay our taxes, therefore we're entitled to this, that, and the other thing. And then you show them how much an X-ray would cost, and then they think, maybe not. Maybe we need to rethink the whole system in the UK because it doesn't cover the cost of what people use it for, which then I think a lot of people in America would have a hard time covering the costs. It's almost like a catch-22, isn't it? Of if you have the way the system's going now, we're struggling financially to make it work in America, let's say, like they're struggling, and we're struggling in the UK at the opposite end of the spectrum where taxes cover it. Where does it actually do well? What country has a good medical system that works and operates well and delivers the high standard of care without all of the struggle, the financial struggle, the unable to access it in some cases, waiting months for treatment, and in some cases you start to recover before you see anybody. Like, where does actually do this right?
Michael, it's so hard to talk about cross-country healthcare comparisons. We're not talking about the same population because US older aged adults tend to be less healthy than the older aged adults in some of the European countries that you might be thinking of. Yes, there are countries that get great healthcare outcomes. Singapore would be an example of one. However, the Singaporean population isn't the same as the US population. By and large, the US population is less healthy. They're subject to more chronic conditions, for example, diabetes, namely.
Right, so it's almost like they're doing the best they can with the people that they have. It's almost like if they're healthier, then well, that might be why the healthcare system does okay because they look after themselves, which is why there's a big encouragement, isn't there, with things like being active, eating well, trying to keep yourself as healthy as you can so that, there is less strain on the healthcare system and all of the, I guess, consequences of that.
Yeah, I call this EES: eating, exercise, and sleep. Eating, exercise, and sleep. If you take care of those three things, then I don't know if this is your experience, Michael, but it will certainly help treat a lot of medical issues that might come up later on. And that's something that can be part of one's savings program, is to take care of their own health. So they're not as likely to need aggressive treatment later on for some type of chronic condition that would have otherwise been preventable.
I can definitely agree with that because although, I mean, aging has its own complications, and as of
For sure.
recording this, I am not in my 60s or 70s, so I can't speak to, okay, does your body start to really take the mick out of you when you're in your 70s and there's nothing you can do about it? I think that there's probably a case to be made of at some point wear and tear just takes over and there's only so much you can do. But I think that being healthier, feeling stronger in yourself is a big thing. As I've gotten older myself, my ability to recover has become highest priority. Doesn't matter how much strength training you do, doesn't matter how many marathons you run, doesn't matter how much weight you can lift. If as you get older, it takes you a week to recover from your weight session because you've overdone it and your body's not what it used to be, for that week, you're going to struggle to do everyday tasks. So then you got to ask yourself, okay, at what point am I actually not helping? Am I making things worse by trying to make things better? So you then start to have this catch 22 of, okay, well, am I better off pushing myself once a week, twice a week, doing extra things on recovery? Like when I was younger, I used to strength train quite a bit, and I realized I have to spend more time recovering the harder I push myself in the gym. And I think so many people forget that because when you take drugs, let's just take steroids, for example, if you try to enhance your performance through steroids, drugs, any other thing, it impacts recovery a lot better
Mm-hmm.
than your energy in the gym. So you recover like an absolute machine. That's why you can train twice a day as hard as possible. It's not because of your intensity, it's because you've recovered so well that you're able to go back in and do it again and
Right.
recover the next day, go back in and do it again. And that's where you get the results from. It's not in the gym. It comes at it from the angle of, well, it doesn't hurt as much and I wake up feeling fine. Therefore, I can go in and train harder every single time I'm training. Which, when
Yeah.
you're 30 and 40 and don't take the supplements and don't look after yourself and don't sleep and don't focus on recovery, you simply can't do that. It's
Right.
impossible
Right.
if you don't recover. So I found over the years that recovery is more important than the training.
What are
That's
some of
been
the
my
tools you
experience.
use for recovery?
Me personally, I try and get enough sleep. Um, since my degree and my focus on like the way the body works and the way we can enhance systems of the body without really doing any serious damage. I've become a big believer in listening to my body a little bit more. And if I feel stronger, I work harder. So I do a couple of tests to test how my body is actually performing.
Ah.
So things like grip strength testing is a
Mm.
good test of how your nervous system is. So you test your grip strength. If you're a bit weaker that day, based on, you just make a note of it. So what's your highest, what's your lowest, and you work within that. So if you're at 90% of what your grip strength has been over the past 3 months,
Is
you
this a
can train pretty
machine
hard today.
that measures your strength, your grip strength?
Yeah, so it's just like a grip strength. I don't know the actual technical term of it. Grip strengthometer. Can't think of any other word for it. But basically, you squeeze and it gives you a weight in some cases. In some cases, it's like a or another way you're doing it is you could just like hang like a dead hang position,
Sure.
and then you time yourself, which just takes forever. Like if you get good at it, a test could take 2 minutes, and you
That
could just
itself
do a
sounds like
grip
a
strength
workout to
test,
me.
and then yeah, it is, because you could get the same result just by buying a grip strengthometer. You're gonna have to Google what the actual technical term is, those that are listening, because I can't remember what it is. But testing your body to see how you're feeling that day
Hmm.
and going off that has proven to
Hmm.
be quite helpful,
Yeah.
because you might feel great, decent enough night's sleep, but your grip strength is off. Don't
Yeah.
go into the gym thinking you're feeling amazing because you've had a decent night's sleep
Yeah.
when your nervous system's not ready for it, and then
Yeah. Absolutely.
you end up suffering
Absolutely.
for it for 2 or 3 days afterwards.
Yeah. I mean, exercise is an important component, as is eating and sleeping. Also, don't want to fail to mention the importance of relationships. You mentioned your relationship to yourself and your own recovery when you train, but our relationships with others is also important. Having a loved
Yeah.
one that you can confide in,
Mhm.
having a good social network are all things that contribute towards feeling healthy and being well.
Yeah, it's interesting how your response to stress can shift
Yes.
based on how you feel in the moment. Like I can be stressed out, but feeling pretty good doesn't feel the same as if I'm stressed out and not feeling great. So it's like how you see the stress, like how you perceive it, how your body responds to it can also be a big thing. Like I've started, funnily enough, having semi-regular massages as well.
Oh, yeah. Yeah.
And sometimes they turn around to me and say, look, how your body's responding to the stress that you're putting yourself under has actually got better over the past 6 months. So not only do you massage to alleviate the consequences of the stress physically, you're able to adjust how your body responds. So you don't get as stressed, you don't get as physically stressed,
Yeah. I
and you're
wish
then still
Medicare
able to
covered
do it,
massage.
still able to
Doesn't cover
function.
therapeutic massage, unfortunately.
Yeah, it never gets any worse than what it was like when you first do it.
Mhm.
That's been fascinating to me. Like the idea of you can start whatever training or therapy that you want,
Mhm.
and even something like stretching, fairly straightforward. The first time you do it, you hate it because you can't stretch. You're like a brick. You can't move your legs. You can't move your arms. You feel a bit like a failure when you first try and stretch. But then after 3 months, you're flexible. You
Yeah.
don't feel it as much. It doesn't hurt as much.
Yeah.
So many people stop at that point though. Like they get to a point where they want a maintenance dose, that where they can get away with like a minimum effective dose of whatever it is,
Mhm.
and then they stop. And I'm convinced it's because the convenience of doing it is the same as the convenience of not doing it. Like there's no consequence of stopping because you feel fine,
Mm.
versus the consequence of keeping on going just to maintain.
I think of it a little different. When someone stops a otherwise successful routine, to me, it's a symptom of boredom. They're tired of the same thing each day. People love variety.
Yeah, I'd probably agree with that. And I also reckon sometimes it's that cost to benefit thing as well. And they probably tell
Hmm.
themselves that I'm bored, but if I don't
Hmm.
do it, it's not a big deal.
Hmm.
Sometimes they
Right,
don't
because
have a
they already
consequence of
have
stopping.
the flexibility that they were
Yeah,
seeking in the first
yeah,
place.
yeah. Which
Yeah.
then makes me think, is the healthcare going to be like that as well? Is the healthcare system going to be similar, whereby they won't be as relied upon anymore if they actually help people get to a point where they don't need to be as much of a burden? They then stop relying on the system because they don't necessarily need it. Which then makes me think, okay, is it all about money then? Like, is it at a point where if people start paying into it because they feel like they no longer need it, what happens then?
Where they stop paying into it.
Yeah, like the people stop buying into the Medicare idea because they look after themselves and take care of themselves and they do the things that you mentioned, exercise, nutrition, and sleep. And it does help to prevent a lot of the things that Medicare would be there for. What happens then?
Well, it's a choice to have Medicare. People can opt out, but if they opt out, then there's a late enrollment penalty when they
Ah,
decide to opt back in. So it's a
yeah,
carrot and stick.
carrot and stick. I sometimes I wish we had more of those carrot and sticks with things health related. Like if there were more consequences for not doing something that's beneficial, more people would probably do it.
Yeah, and also people are used to paying hundreds of dollars a month for health insurance. Even for a healthy 30 some, it's still quite expensive to have health insurance. We're talking about $600 to $800 a month. And if you're married, then it's in the thousands per month.
Yeah, I
Medicare,
imagine it's so ingrained into society in a way. You've got to look after your future. You've got to plan and prepare and look after yourself or be able to look after yourself in your older years. It's like an insurance policy for your
yeah,
health.
exactly. Medicare, though, is a lot more affordable than private insurance coverage by and large. People are surprised at how reasonable the premiums are for Medicare. So just to take that example, for a private policy for a 35-year-old male in the US typically would cost about $600 to $800, depending on the state they live, even more potentially. Medicare, though, let's say, Michael, you just came off your work provided coverage, you're 70 years old, I've granted you American citizenship, and your premium would be $164.90 per month for Medicare.
Right. Why is it so cheap in comparison to a private company?
It's a great question. The reason there's a lot of reasons for why it's less expensive. One of them is because there's generational cost shifting. So younger Americans are footing the bill for older aged Americans to have more affordable health insurance.
Right, okay.
Another reason, though, is because Medicare negotiates and is and has some level of cost control on what they pay to doctors for an X-ray, let's say, or for an office visit, or for a specialist visit, depending on the specialist that you need. There's a fee schedule.
Right. So how does things like inflation factor in? Because if they're able to freeze somewhat the costs, well then inflation goes up for the hospital or the practice or even the person paying Medicare every month. How does inflation get baked into the idea of it being affordable, or does it increase as well? Like inflation affects the cost as well.
Yeah, it's a great question. So in the U.S., the healthcare industry is about 18% of the U.S. economy. And healthcare inflation has definitely been a driver of inflation overall for the past 20 years. Costs have definitely increased for healthcare services. There has been inflation, undoubtedly. Um, since the pandemic, though, and overall inflation has really ticked up since the pandemic, especially here in the US. Healthcare inflation hasn't matched the general rate of inflation by and large. And this is debated, but it seems like there have been better cost controls since the pandemic started on healthcare wide inflation as opposed to general inflation. Whereas it was the reverse
Right.
previously.
So the inflation was higher than healthcare inflation. Am I right in saying that, or the other way around?
Since the pandemic.
Yeah.
So this is a hotly debated topic. It appears the consensus is that the rate of healthcare inflation has slowed relative to general inflation. And that might be just because general inflation has gone up so much, right? It was almost at 9% here last year. That was actually the cost of living adjustment that Social Security gave to
Right.
beneficiaries for this upcoming year, 8.7% increase in their cost of living adjustment. Healthcare inflation has been estimated to be lower than 8.7%. Now, one reason people speculate is because some have deferred getting healthcare that they would otherwise have needed. For example, at the start of the pandemic, they didn't want to go to a hospital because they feared being exposed to COVID-19 if they needed to see a specialist.
So
So it
there
might
was
be
a lot
kicking the
of
can down the road.
yeah, yeah. That was the impression that I'm getting as well, where people are less likely to use the healthcare system if the risk is there
Right,
because of COVID. So people are like, no, I don't need the operation because
right.
I don't want SARS or COVID or whatever the trending viruses of the time. But
Yeah,
it's making me think
exactly.
that the resources are, I mean, are they the same? Like if because as a population we're getting older, we are healthier than what we
Right.
were. We're getting older, we're
Yes.
lasting longer, in air quotes. How does that affect Medicare and the access to medical resources?
It's I'm so glad that you brought this up. The life expectancy since Medicare's creation has increased quite a bit, by over 10%. So
Wow.
the average life expectancy has definitely gone up in the aggregate since Medicare passed in the mid 1960s. And that has affected costs as well, because as someone ages, they need to access more care. And the costs are especially high in the last couple years of someone's life. That's really when they rack up a lot of healthcare costs in under Medicare. That's where it becomes very expensive to provide healthcare to someone, depending on the course of treatment that they and their family choose.
So is it a bit strange that because you mentioned before that the younger generation are in a way paying for the older generation to have access to it and to maintain the costs. So it's a way of like flattening the curve, so to speak, when it comes to cost and expenses and those kinds of things. How do you see it playing out then if we continue to get older? Like if we think, okay, if we add another 10% onto this, what happens then? Like, do you get people into jobs earlier and get them signed up for Medicare earlier to keep the cost the same, but then the even younger generation then start paying for the even older generation to so you've got these like opposite ends of the spectrum. Whereas is there another way? Is there a better way? Because I want people to live longer and healthier lives. It would be great if people could have like a longer health span, healthier for longer.
Sure, sure. Yeah. Health span would certainly be one way of attacking the problem. So, Michael, let's unpack your question, because I think you bring up a really good point, which is that if there are, if we're not entirely footing the bill for the Medicare program, then the can is getting kicked down the road in terms of who will bear the costs, right? Those unfunded obligations
Yeah.
will lead to higher taxes ultimately for the generation that doesn't yet have Medicare. They will have to bear the costs. Now, getting one proposal has been to actually push Medicare from 65 to 67. And an example of a country that just used this to help smooth its obligations for its older age population would be France, and how Macron has proposed to shift the age for pensioners, right? He has proposed it was in the early 60s, and he proposed moving it to the mid 60s. Very unpopular
Oh, I can only imagine.
because a lot of French people rightfully planned to retire in the early 60s. They contributed to the system, and now they feel like the goalposts are being shifted. So that
Yeah.
would be quite tricky. Another thing we could do is raise taxes to make sure that the program is better funded. That would also be highly unpopular, especially in the United States.
Yeah.
And our politicians would have a lot of difficulty agreeing on who should bear the cost. The other, and there are many, many proposals. So this is just, I've just mentioned two, but the other would be cutting benefits, cutting what Medicare covers, or downshifting the amount that it would cover. That would also be quite unpopular for a number of reasons and less desirable in terms of health outcomes, probably. So there's no silver bullet and there's no good answer here.
It sounds like at some point the system's just not going to be, it's like it's collapsing under its own weight almost. And it's making me think, is there a better option? Oh, obviously, a lot of companies need to make a profit, they need to be able to function. Governments is the same way, hospitals the same way. There's so many moving parts that all have to work together and coexist and find a way to get along, essentially. And then
So
dealing
you
with the
just
public.
hit the nail on the head. And that approach, the private sector based approach, is one that the government has been experimenting with here in the US since 1997. They created, so the three legs of the Medicare stool: hospital, medical, drug coverage. You can keep original Medicare if you like. Alternatively, you can choose a replacement for original Medicare administered through a private insurance company. It's called Medicare Advantage here. And over 50% of Americans have actually opted for this privately administered plan. Now, what's the rub? Well, even though it can provide more additional benefits, it's managed care. So that is, there's a gatekeeper under most of these plans. And the gatekeeper, there's prior authorization for whether you get the care or not. Of course, there's an appeal process too. So it's not as if the plan gets to tell you whether you can get a procedure. I mean, if you do get a denial, for example, you can appeal the denial, but that's not how original Medicare works. So essentially, there's a private option that was designed to help control costs. Has it helped control costs? It's really hard to do an apples to apples comparison here between original Medicare and Medicare Advantage and how well it might help in terms of cost control. But the program, the idea of Medicare Advantage was designed to help control costs overall. So there needs to be more study as to whether it actually does or doesn't.
Is there anything that you've noticed actually work and actually help cut costs? I mean, it must be difficult in the UK to really track this kind of thing, but like, is a healthier lifestyle able to cut costs? Is thinking long term able to cut costs? Like, is there anything that you've seen in your years of studying this and working with people with this that's actually worked and helped? Maybe if you're healthier, there's less costs when you're older. I don't know if that's the
Yeah,
case.
I have actually, Michael. The number one way I've seen someone control costs, and this was mind blowing to me, is someone I worked with 3 years ago hadn't seen the doctor in 15 years. So encourage them to make a doctor's appointment. They went to the doctor 2 years ago. They had chronic conditions and it required very, very expensive course of treatment over the
Wow.
year. So now what do they do different? Each year at the start of the year, they go for a wellness check. It has
Okay.
substantially lowered their out-of-pocket medical costs just as a result of having a check-in with their doctor, because they realized that they weren't in as great a shape as they thought they were. So then they started making lifestyle changes because they want to live as long as they possibly can. And so their costs went from tens of thousands of dollars 2 years ago to only a couple $1,000 for this past year. And celebrating wins like
Wow.
that is really what makes me think it is possible to control costs overall.
It must be a bit a crazy thing for them to go through. It's kind of like if you've been diagnosed with something that then can cause the wake up call. But then as you said, you've got people that like if you're going in for a test, generally speaking, you prepare for said test. If you've
Hmm.
not been to see the doctor in over a decade,
Hmm.
you won't have need to. It's almost like, I mean, over here in the UK, like things like seeing your dentist or seeing an optician for your eyesight, that's a voluntary thing
Yeah, it is here
in a
too.
lot of ways. So you wouldn't know if you had any issues with your teeth or your eyes if you don't experience any problems. So unless you start walking into lamppost, I mean, you're not going to go and see the opticians,
Right,
just because you can function. Same
right.
thing with like your teeth, unless you bite into a nut and you've got a tooth sticking in it, you're not
Yeah,
gonna. Oh, maybe I should go and see the dentist. So I think a lot of
yeah,
people have these hidden issues or concerns that because it doesn't
yeah.
hit them in the
Michael,
face in a way, you're not going
while
to
you're
do anything.
speaking, I can't help but think of a fellow Brit, Roy Sutherland. Have you checked his work?
Ah, I haven't. No.
But he worked in advertising, and now I would really say he's a psychologist. And he talks about satisficing. So I completely agree, right? Unless you have a toothache, it's unlikely that you would go to the dentist unless you've built a routine of getting regular cleanings.
Yeah, it's a weird. I think it's a human condition in a way. But I think some people need, similar to what we said before, that people need to do things to prevent the thing from happening. It's almost like you never experience any symptoms. Like if you want to live pain-free, then you've got to do things when you're pain-free to prevent the pain from, don't wait for the pain before you do anything. Like, okay, I'm going to experience this in the future. If I start now, I may never experience it. I may never get, I don't know, a slip disc or whatever if I start doing yoga when I'm young and I just don't stop. Just have this
Yeah,
element of this is something I do all the time, no matter what, because I know for a fact when I get older, my body is going to start hating me. And I'm going to want to do something about it now instead of waiting for it to get any worse or waiting for the back pain before I do anything.
very, very difficult to get in that type of mindset because you have to think about what will it look like in 10 years if I don't keep investing in myself. You think,
Yeah.
well, it'll
Mhm.
look about what it does today. I'll feel about the same way that I do when I'm not working out today. But
Yeah,
10
it's
years
so
of
tough.
entropy is a lot.
It is. And then you've got like the inertia of steering the ship as well. Like if you're trying to steer the ship towards health, how long do I have to keep doing this before I start to feel healthier? But if
Yeah.
I've got to
And
wait 5 years before I start to feel any benefit, I've got 5 years of doing something over and over and over and mind-numbingly over again before I start to feel like I'm benefiting. And sometimes the benefit, I don't know if you've experienced this, but sometimes the benefit is just being the same as you were when
mhm,
you were younger. You don't get
mhm,
any better,
mhm.
you just don't
That's
get
right.
any worse. So you don't
That's right.
necessarily get any benefit. You just don't experience any negative from not doing it. So it's not,
Right.
you're not really benefiting a lot of the time. You're just not having the pain, the suffering, the conditions, the illnesses, the injuries that people like you would experience without doing those things. So it's like more of a neglect issue than a doing it issue.
Yeah. And, even when friends describe various injuries that they have or how much their lower back is hurting them, you can't compare the pain of your own headache to someone else's headache,
No, no, no.
right? So it's very hard to conceptualize what it would look like to experience that degree of pain in
Yeah.
10 years. And it's
Mhm.
easier to think, well, I'll just feel about the same way I do now. I'll just be 10 years older.
Yeah, it's so hard and confusing. And I think this is, I guess, it's like a real reason why we have the problem that we have. It's
What is the
not a
problem in the
negative.
UK?
Well, I mean, it's like the idea that you don't do anything about the thing until it hurts, until it
Mm,
affects you. Otherwise, you don't do anything. I don't think that's just a UK thing. I think that's like an everywhere thing. Well, then I guess in the US, because you have to pay for a fair percentage
hmm
of what you're getting
hmm
medical wise,
hmm
some
Yeah,
people put it off because of the costs.
yeah,
Where in the UK, we may not necessarily have that unless we decide to go private. So if we use the NHS, not
yeah.
everyone does, if we use the NHS, we can get it fixed like when it's small, like before it
Right.
gets so big, because we may not have any cost involved financially of doing it. Paying private, I guess you just get the treatment quicker in a way, which then would cause this catch 22, isn't it? Of if I wait until it hurts, I've then got to wait 6 months potentially. How bad is it going to be
And
before
yeah,
I actually get this thing seen to and this thing treated or find out what it is in some cases?
sure.
Whereas in America, you can, in a way, like pay to have it seen to when it starts to creep up if you have the finances, where some people don't, especially in the older generation. Maybe they retired and they don't necessarily work full time or have the funds to be able to pay, I don't know, thousands for an x-ray or a CT or whatever the case is. And it's like, well, what do I do now? It's like no matter which way you look at it, unless you have the money, you're going to be waiting, so you may as well add yourself to whatever list that you're suspicious of, because it might take a while before
Yeah,
you actually
Michael, I
get seen
haven't
to.
experienced the UK healthcare system, but that's not quite how it works in the US. That there wouldn't be a queue to see your doctor if you're on Medicare, and you would have a pretty what people appreciate about Medicare is that the government is going to pick up its 80% share. And so then all that you have to reckon with is the 20%. And there are two types of additional coverage here that you can choose to cover the 20%. I write about them in my book if someone is curious. But it's pretty straightforward as to how Medicare will cover. It's much less straightforward for someone who's on an employer plan and less than age 65 here.
Right. So there's a way of like the fact that it's part contributed is how the system is sped up, I guess. I suppose in some ways does depend on how big of an emergency it is. Like if it's an emergency, then you get it on the day because it's a priority versus something that the routine checkup or whatever the case may be, you're then not kicked down the road, but you have to wait a bit longer depending on what the symptoms are or what the situation is.
I think research shows that one area in which the U.S. healthcare system is fairly strong uh, when doing a cross country comparison is on providing critical care. So when someone really needs to go to the hospital, then there typically is a pretty good they have a way to access the system without waiting too long in order to get care that they need.
So where would like the older generations tend to struggle then? Like in what way is the system not necessarily built for the kinds of people that may actually need it more?
This would really depend on the type of person that we're talking about. For example, if we're talking about someone who needs home health care, there's an area in which Medicare could do a lot better. It provides very little benefit for someone who needs treatment at home. And we are seeing older aged Americans wanting to stay at home rather than go to some type of skilled nursing facility. They enjoy the comforts of being in their own house rather than some austere environment that reminds them of a hospital. So here,
Yeah.
the system could actually do a lot better job at controlling its own costs if we had a way for them to access the medical system at home. And right now, it doesn't do a great job at providing home health care, and it's difficult to get covered.
That would seem like if it was a popular thing, so let's say the majority of people of a certain age would rather have access at home because they want to be at home, comfortable environment as opposed to a hospital. Why don't they offer something like that or have a system in place for people that want that, or is there just not enough of a demand for something like that?
Oh, I would say that there's significant demand. And in fact, some Medicare Advantage programs, Michael, here, I think this might help explain part of the difference between the US system and the UK system. So in the US system, the type of Medicare Advantage plan that you can choose varies based on where you live. It varies based
Mhm.
on the state, based on the zip code, based on the
Wow.
county. So there's hundreds of health insurance companies offering thousands of plans nationwide. So we're talking about a program that's managed at the federal level, Medicare. But then in terms of the specific plan that you choose, if you go the Medicare Advantage route, it's going to vary based on whether you live in Arizona, California, New York, or Florida. Now, some plans, specifically ones that come to mind would be in Florida, do provision home health care services. But I'm here in Arizona, and there are very few plans that would provision that same type of coverage that would be available to someone in Florida. And so this is where it gets to be such a tricky question because at the federal level, Medicare provides very little support for home health care services. In fact, there's a Goldilocks test essentially. Can't be too sick, can't be too healthy in order to qualify. But then if you replace original Medicare with a Medicare Advantage plan, it is possible that it might offer more home health care services. But it would only be if you live in a certain area and have access to a certain plan that would provision it.
So if you live in California and you want home health care, move to Florida is kind of the way it's going. Like people are gonna move house depending on what medical plan that they would like, which would then you research the state, you research the zip code, and you think, I can get healthcare at home here. I'm going to move, I think, is the long-term plan.
Potentially down the road. I know I haven't come across that in more than a handful. Only fewer than I can count on one hand are coming to mind with
Right.
people who have moved states in order to access a different type of healthcare benefit. But
So why don't they standardize? Is it because there's 50 states, every leader has their own policy procedure around what they think the right healthcare should be like? Is it almost too fractionalized, do you think?
so Medicare is standardized at the federal level.
Right.
Medicare covers 80% of someone's medical costs. However, to cover the other 20%, there's two options. On one hand, there's a standard program that has also been, can you, um,
Yeah. Yeah, yeah.
now to cover the other 20%, there are two options. On one hand, you can get a supplement. It's also called Medigap to cover the other 20%. These Medigap options are standardized under federal law. Full stop. You can access the same care in Florida, California, New York. On the other hand is Medicare Advantage, which we've been talking a lot about. Medicare Advantage is going to vary based on where you live. In a state like Alaska, for example, it's not even an option. But in other states, there's a ton of competition. If we look at Illinois, for example, in the county that includes Chicago, there are almost 60 different plan options to choose from with Medicare Advantage.
Wow.
What's going to vary, though, is how it covers your doctor, whether your doctor is covered at all. They must be in network. Two, how it covers your prescriptions. And then finally, your priorities. If you want to do a lot of, if you want a snowbird and live in Florida in the winter, then your Medicare Advantage plan isn't that the Medicare Advantage plan you chose based on living in Chicago isn't going to work very well in Florida.
Is the fact that it's quite confusing part of where the problem is with the system? Like, do you think it's just too varied, do you think? Or where do you see the actual problems with this? Is it just the weight of the demand? Is it the increase in cost? Is it people aren't on the right plans for them? Like, how big is the issue? Because as you can probably guess, those that are listening and yourself as well, Ari, it's quite confusing. Like, I'm trying to wrap my head around it, and I feel like there'd be a lot of people that are actually on plans that are not the best fit, which would then
Yeah,
cause issues
yeah.
further down the line.
Unfortunately, most people aren't on the right plan, as noted. The what's fascinating, Michael, is that there's a time each year when people can shop their coverage and find a different plan. It's called the annual enrollment period here in the States. And it's in the fall. It's in the fall every year. By and large, most people don't shop their plans. They don't. They just stay on the plan that they were on. And it's a real loss, which is why my co-founders and I started a company. The company's name is Chapter. And what we allow someone to do is to shop all their Medicare options nationwide.
So is this why you started it? Because you realized just how complicated it is and how hard it is to make sure that, because I picture the healthcare system having an easier time if it was more tailored. Like, you wouldn't have to put cost in places that they were not needed or not used by the individual, especially if you're paying like 20% or more and the government's then paying 80% all into a system that not everyone's using, or the
Mm-hmm,
person that's paying for it isn't using. I feel like if 100% of it was going to where the person actually used it and
mm-hmm.
warranted it, they might not need as much investment because they might not be needing as much.
You can't negotiate how much you pay for Medicare. It's a standard amount, and 85% of
Right.
Americans pay about $165 per month for Medicare. Now, in terms of accessing the benefit of their Medicare, though, you're absolutely right, because people should be scheduling, for example, this is the time of year to be getting a wellness check, which is very similar to a physical here in the States. This is the time to be doing it and to be accessing their benefits so that they can protect their health span and prevent chronic conditions or treat it.
Yeah, I'm starting to get the picture that a lot of it is a system that people don't necessarily use all of, don't necessarily take advantage of,
Mm-hmm,
and yet the money just kind of keeps rolling in, whether they use it or not, because they pay monthly and then they contribute to the services that they use.
mm-hmm.
Is there an element of they want to keep it this way? Like, is that the impression that you get? Like, they want it to be this way because whatever it is, it's like gym memberships rely on members that pay and don't use the gym because
Mm,
it's the
mm.
only way they could operate, and they're
Sure.
hoping that people don't necessarily stick to their regimens, but then just stop going for
Right.
whatever reason. Is that the impression that you get from the healthcare system, whereby, okay, well, if people pay monthly and they have a checkup every 1 to 2 years, and maybe they need something from us every 4 to 6 months, and that's it. It's like, well, it does give you that impression in a way. I'm probably wrong,
Mm,
but I
mm.
kind of feel like it's a system that's feeding itself a little bit, and then it's like, well, okay, it's a bit like
Michael,
almost like
this
it's almost like home insurance or car insurance, where like people just keep paying into it and they're kind of hoping that they just ignore the payments almost.
yeah, so the point that you're making is people only need it once they're broken, once they really need some type of intervention. So, for example, to analogize it to car insurance, it would be only when you get in an accident. That
Yeah, yeah,
doesn't match my experience so much. Here at Chapter, most of our members actually see the doctor regularly and get quite a bit out of their Medicare. Now, are there some people who don't have a visit for a couple years? Of course, but that's very different from car or house insurance.
yeah. I mean, I get the impression that it might need to be a priority for people before they then start to do that. So do you have any examples of people that, let's say, they don't have health conditions, there's no like pressing need for them to do it,
Mhm.
and yet they do it from a maintenance perspective, you know, where like I've got health conditions, so I see someone every year, I have multiple checkups every year as a maintenance dose for me,
Yeah,
but I also
yeah.
need to. Does anyone do that that doesn't need to? And they go in and it's a bit like when I go in and have checkups for my teeth, let's say, Ari, I go in and they go, yeah, everything's fine. See you next year.
Hmm.
Does anyone do that for like healthcare where they go in, you have a physical and it's like, see you next year, but you're fine, like, there's no issues, but you'd be appreciate the fact that you're coming in and keeping yourself, you know, aware of what's going on?
I would say that describes many of our members. Is now women are women tend to be more conscientious than men and better
Ah,
at the type of
okay. Yeah.
follow-ups in going and making sure that they have a primary care doctor and that they see their OBGYN, for example, and that they get regular screenings for breast cancer, for example. And it's important too that people regularly have colonoscopies. They're just scheduled preventative um, scans that need to happen in order to maintain one's health.
So what is the kind of person then that is, because we're getting to a point in the conversation now where it's okay, most of people that you tend to see are on the preventative side of things, and yet a lot of the concerns are the system's collapsing under its own weight, it's struggling financially to cope with all of it, and not just like the general thing, like the whole system will likely struggle if things aren't changed and if things aren't improved on. What kind of situation could you paint for people where it's like, yeah, but they don't use it, they're not on the right plan, they're not using the services that they have access to,
Mm-hmm.
causing further issues down the line?
Yeah, the main issues we see here is that someone chooses a plan that doesn't have their doctor included. That's a major issue when the doctor that you have a trusted relationship with isn't covered by the plan that you selected. And
Right. Yeah.
unfortunately, a lot of advisors in the States are captive to one health insurance company or a handful of health insurance companies, and they aren't searching across all the plans that someone's doctor might accept or all the plans that would offer the most benefits for that person. We've named several throughout this podcast, including home health care, gym membership. These plans can even include a flexible spending card that counts towards dentistry, for example. And so it's important for someone to make sure that they're getting their three met. The three P's are your providers, make sure your doctors are in network, your prescriptions, make sure they're covered affordably. Then finally, your priorities, what's important to you.
So one of the biggest issues that we're actually facing is the fact that they're not choosing I guess the
Optimal plan.
foundational things. Yeah, they're not
Yeah.
choosing the right plan. They're not choosing something that they can access conveniently. Like the doctor's someone that you can just go and see. And the
Yeah.
idea of that not
Convenience
being
is a
covered would
huge
make it hard, make it difficult to get any advice at all if it's not covered in any way.
convenience is a huge factor. Some of our members have trouble making it to the doctor. There are plans that include a transportation benefit. So if you don't have a way of getting to your doctor's office, the plan provides for a benefit where they'll come and pick you up and then take you home.
So is this affordable? So like if we divert funds from one aspect of a plan to the more effective aspects of the plan, the things that the individual actually values and actually would benefit a lot from, do you see costs being the same, being more, being less, being more affordable by shifting the plan from one element that they never use to another element which they would use all the time? How
Mhm.
do you see that changing the cost to the consumer or the patient, let's say?
Ah, okay. So, case by case, absolutely. Someone should be maximizing their plan based on what they'll actually use and how they'll use the plan, which is an individual discussion based on the healthcare outcomes that they want to achieve and what's important to them, and also what they're willing to commit to. Right. Now, in the aggregate, though, how these cost savings add up, that's a much fuzzier picture. But it seems like it should have some effect in the aggregate.
Because I imagine like if doctors included, but then the transportation element which you mentioned may
Yeah, it
not
cuts
be
benefits
covered.
elsewhere, right?
Yeah,
Is
yeah.
that what you're saying?
It's what I'm picturing, but then if you're paying for 20 or 30% of that, they're more likely to do it if they're being paid for it in a way. If that makes any sense. Like if it's like a bonus or an add-on to your policy, that may increase the premium for you in a way.
So are you talking about doctors getting compensated for achieving better health outcomes for their patients
Well,
and
I,
like
I I was
measuring how
thinking like
likely?
if, let's say, if someone doesn't need prescriptions, but they want the doctor to pick them up because they're having a hard time getting to the doctor,
Hmm.
if there's a plan which has that shift
Hmm.
where they don't need to pay for prescriptions because they don't really need it, well, then they have the extra accommodation that they would likely need to see the doctor. Does
Hmm.
that shift the plan? Does that add any premium for them because it's I guess a premium on the service or an additional thing that they would have to do to accommodate the individual?
I don't think that there would be any special incentive to encourage that type of compliance. And this might be too on the nose, Michael, but what we find here at Chapter is that our clients really appreciate mail order prescriptions. So when it just shows up at your doorstep, it saves you a trip to the pharmacy. And then you have a 3 month supply of the medication that you needed. And that actually helps with compliance. Now, with making sure that someone continues to take their medication is that they have a way where they get a new shipment before they run out of the old one.
Yeah, it's similar in the UK, where as far as I'm aware, unless you order it particularly for 3 months, you typically get it monthly, which for some people, if they can't get to the pharmacy every 3 months, trying to get to the pharmacy every month is probably going to be three times as hard. Just using that
Yeah,
as an example.
yeah, that's right. That's right. And it's quite we help people every day with sending their doctor's scripts to the pharmacy mail order. Now, of course, we're talking about private insurance here, so it's important that the doctor's office send the script to the Part D is in drugs, insurance carrier, so that they have the script on file and can then send the prescriptions to the member's doorstep.
Have you ever sat down and had like a thought experiment of how you would change or improve the medical system, Medicare for all the generations? Have you ever had that thought process yourself? Like sort of go, okay, I run chapter, we do really well, but
Mm-hmm.
if the Medicare system was a bit different, if it was better in this way or that way,
Mm-hmm.
maybe we make this change over here.
Mm-hmm.
Does it improve things? Have you ever had that thought experiment?
Oh my gosh. Yeah, yes, of course. There's so many changes I would make if I were in charge of the system, but I'm not. And what we can do is instead realize the strengths and weaknesses of where the system is at presently, and then help our members maximize them. And I think the main way is that the system is opaque, it's patchwork. And of course, there are hundreds of health insurance companies offering thousands of plans. So, as a starting point, you just need to have a tool that compares all of these different plan options. And that's something we've managed to accomplish over the past several years.
Well, I would really like the people that are listening that are in the US that want access to the plans, be able to shop, compare, maybe even adjust things if they have that level of customizability of the plans to be able to do that. So here's your chance, Ari, to share about Chapter, share about the work that you're doing. How can people reach out to you? And are you on social media as well? So there's your chance to get people to connect with you as well.
Oh, thank you so much, Michael. It's been a pleasure to join you. Please check us out at askchapter.org. You can also send me an email at Ari, A-R-I, at askchapter.org. And of course, you can read my book. It's on Amazon. The name is It's Not That Complicated. And if you can't afford it, just send me an email and I'll send it to you.
Thanks so much for being a guest on the show. Those that are listening, feel free to subscribe, share the show, tell others, and also leave a review wherever you are listening into your podcasts. Ari, thanks so much for joining me, and I look forward to keeping in touch. Thank you.